Assalamualaikum. Hi, my name is Batrisyia Adrina Binti Roslan. I'm a U1 medical student and my matrix number is PM24110038. And today I'm gonna talk about dermatology. So, what is dermatology? Well, dermatology is the area of medicine that deals with the skin, and it also a specialty that includes post-surgical and medical elements. Dermatologist is the specialist in this field that helps in treating conditions affecting the skin, hair, nails, and cosmetic issues. Next, I'm gonna talk about the anatomy of the skin. The skin is our body's largest organ and it covers our external surface. And the major function of skin includes protection, for example, against mechanical or chemical injury or also UV radiation, temperature regulation, excretion, sensory perception, and also formation of vitamin D. In our body, there's two types of skin, thick and thin skin. Thick skin, unlike thin skin, it lacks sebaceous gland and hair follicles, and you can find your thick skin on your palms, your fingertips, or your soles. But for thin skin, you can find it all over your body. And also, thick skin has a thicker epidermis layer compared to thin skin. So, the skin consists of three layers. We have the superficial layers, which is the epidermis, the middle layer dermis, and the deep layer hypodermis. So, the epidermis is our outermost layer and it consists of five layers. The bottom one is stratum basilae, and as we go to the top, we have stratum spinosum, stratum granulosum, stratum lucidum, and stratum corneum. And the cells in the epidermis includes keratinocytes, melanocytes that helps in producing melanin and protect our skin from UV radiation, Langerhans cells that helps in immune response, and also Merkel cells that will act as a mechanoreceptors. The next layer we have is the dermis. The dermis consists of two connective tissue layers, which is the papillary and reticular. And the dermis consists of sweat glands, hair follicles, smooth muscle fibers, sensory neurons, and also blood vessels. The last layer we have is the hypodermis. The hypodermis, also known as the subcutaneous fascia, and it contains adipose lobules, sensory neurons, blood vessel, and skin appendages. So now I'm gonna talk about the vitamin D production on our skin. So, as our skin exposed to the UVB radiation, it will convert 7-dehydrocholesterol into pre-vitamin D3. And then this pre-vitamin D3 will undergo a heat-dependent transformation to become vitamin D3, cholecalciferol. But this cholecalciferol is still inactive, so then it would be transported to the liver where it would be converted into 25-hydroxyvitamin. And then 25-hydroxyvitamin will be further converted into 1,25-hydroxyvitamin D in our kidney, which is calcitriol, the active form of vitamin D. And then this vitamin D will help in absorption of calcium in our gastrointestinal tract. Now I'm going to talk about the disease related to the skin, which is psoriasis. Psoriasis is a chronic inflammatory skin disease with a strong genetic predisposition and autoimmune pathogenic traits. And then psoriasis is a skin condition characterized by the rapid buildup of our skin cells. And you can mainly find the psoriasis on the elbow, your knees, your scalp, or the trunk. So, the types of psoriasis include psoriasis vulgaris, which is the most common type of psoriasis, inverse psoriasis, which is a type of psoriasis that affects skin folds, for example, under the breast or around the armpit. And next, we have the guttate psoriasis, which usually affects the children or adolescent. And lastly, pustular psoriasis, that can be localized or generalized. Localized means that it will affect specific area, while generalized means that it would affect large area of the body. Next, I'm going to talk about the treatment for psoriasis. Well, there is no cure for psoriasis, but there is a treatment that aims to stop the skin cell from growing so quickly, and to remove the scales. So the treatment includes topical therapy, phototherapy, and oral or injected medication. Topical therapy is basically like a cream, and it consists of corticosteroids, vitamin D analogs, and salicylic acid. Corticosteroid is a type of topical therapy that would help in treating mild to moderate psoriasis, while vitamin D analogs will help in slowing the skin cells growth, and also salicylic acid that help in reducing the scaling of scalp psoriasis. Next, we have the phototherapy, or known as the light therapy, which consists of UVB broadband, UVB narrowband, and excimer laser. The last treatment that we have is the oral or injected medication, which consists of steroids that helps in treating persistent psoriasis patches, retinoids that used to reduce the production of the skin cells, and also biologics. Now I'm going to talk about the excimer laser. Excimer laser is a type of equipment that we use in treating patches of psoriasis. And the excimer laser is a high precision device that emits a targeted beam of UVB. And it will use to treat localized area of psoriasis such as plaques on the elbows, knees, or scalps. So now I'm gonna talk about the specialist in dermatology. Um, I will be giving two examples of specialists. The first one we have Dr. Nazarin Arifin, and the second one we have Dr. Chong Yusong. And Dr. Nazarin Arifin is the head of the Nazarin Clinic and also a resident consultant at dermatologist at the Pantai Hospital Kuala Lumpur. And Dr. Nazarin is a very skilled dermatology surgery that allows her to perform complex procedure including skin flaps and grafts on top of the usual minor injuries. The second one, we have Dr. Chong Yusong, which is a consultant physician and dermatologist in MD Dermatology Skin Specialist Clinic and Clinicals Hospital Penang. And Dr. Chong performed various skin procedures such as skin biopsy, cutaneous surgery, cryotherapy, electrosurgery, and laser surgery. So, as for conclusion, dermatology is a vital field in the medicine that focuses on the diagnosis, treatment, and prevention of the skin disorder. And the skin, being the body's largest organ, plays an essential role in protecting us from environmental factors and maintaining our overall health. That is all from me. Thank you.